So we got to pretend that that's in a patient, right?
Okay.
That's in a patient.
That's in a patient. So we are going to take and detach our blood pressure cuff from our blood pressure manometer line. We are going to take off the caps of our three-way stopcock and put them on our line such as that. Okay. We are going to take our pilot line and with this off to the pilot line, we are going to attach it to the other end of our three-way stopcock. We are going to take a half-filled syringe and we are going to attach it here, and we're going to look at the units on our manometer. This one is in millimeters of mercury, so we know we're aiming for around 20 millimeters of mercury or less if it seals the leak. Okay? We know if it was centimeters of water pressure, we would aim for 25. The way I remember that is metals are heavier, it's going to drop to the bottom, so 20 is lower than 25 if it was in water. Okay? All right, so we have this off to the pilot line and on to the manometer, and we are going to inject air and pressurize the line up to 20 millimeters of mercury, and then we are going to open the entire system. Okay, and adjust our cuff pressure accordingly. And as soon as we get there, we're going to go off to the pilot line. Okay, and then we're going to take our stethoscope and we are going to listen over the mouth, the throat, wherever we can to determine if there's a leak around this cuff, between the cuff and the trachea. Okay? All right. So then what we're going to do is with that off to the pilot line, we're going to detach the pilot line, and the one-way valve should hold the cuff inflated. And then we are going to detach our syringe and detach our stopcock and put our blood pressure cuff back together so it's nice and ready for the next person. And then we will chart our cuff pressure and make sure our patient's good.